neck injury. She's traveled down from Brooklyn. She has periodic neck pain still, and we're going to see what we can do to fix it and make it feel better. Are you ready to get started, Rosa?
Yeah, let's start.
Excellent. Okay, I'm going to start right here. Okay. Now, I've already done Rosa's exam. We've evaluated where her tightness is in her neck, kind of pinpointed where the problem is. We're just going to do some basic range of motion tests right now before our treatment. I want you to turn your head to the left. Good. Any pain with that?
No.
Okay, now to the right. Okay. So she's restricted to the right quite a bit, probably about 70% of the left side of normal range of motion. So we're going to see what we can do to improve that today. Okay. So we're going to work on some of the muscles. We're going to perform an adjustment because we did find areas that are out of alignment, and hopefully helps her feel better, right? Excellent. Okay. So the first thing we're going to do is I'm just going to pull your shoulder back here like this. I'm just going to pull on your trapezius muscle, and I want you to turn your head to the right. As far as you can go. Good. Back to center. So you can go a little further there. Good. Now back to center. Okay, we're going to do that again. Good. Excellent. She's able to go probably very close to normal because we're taking that muscle that's very tight and that bone that's out of alignment kind of out of the picture a little bit so we can get her normal range of motion. The next thing we're going to do is we're just going to press along her shoulder blade here. She told me in the exam room that the injury to her neck not only causes pain in her neck, but it slides down into her shoulder, which is very typical, the way the muscles and the bones attach, that the pain can refer or radiate into the shoulder or even arm or hand and cause numbness or tingling. She's not having any of that, thank God, but she is having a lot of muscle tension and pain in this area periodically. Okay? So what we're going to do is we're going to put a little pressure here. What I want you to do is just kind of swing your arm around like this. Good. And then back towards me. Nice and slow. You can do that 5 times. Good. And what we're doing is just pressing on some of these tight muscles and bringing her muscle to the normal range of motion, getting that shoulder blade, that scapula to move well. Good. All the attachments there. Good. Excellent. And you can relax. Okay. Now what I'd like you to do is I'd like you to put this arm onto this shoulder, just like that, hold it there. And we're going to loosen up all the tissue. You have no pain in this, right?
Yeah, it feels
okay. It feels good, right? Yeah. Most patients love the way this feels. But what it does is it loosens up the tissue. It helps to increase circulation of oxygenated blood to the area, so the area can promote healing, get more flexibility, more range of motion, and obviously less discomfort. Good. Excellent. Okay, relax that arm. Great. Now what I'd like you to do is lay face down, please. You're going to put your feet right here and your arms down the side. Now Rosa's very, as you can tell, slender and tall. We find that with taller, slender people, posture sometimes becomes an issue. So we're going to work on helping to make sure all these muscles that control and keep our shoulders back and our head upright, that there's no restriction. You can feel that, and it's kind of knotty, right? You feel that? Yeah. It's kind of like a ropey band. And we're going to just spend a couple of minutes just working through by doing a little bit of cross friction, myofascial release in here. Nothing painful, just kind of getting that tissue to cooperate a little bit. Excellent. And I'm just going to put a little pressure here. You okay with that?
Mm-hmm.
There as well.
That's where you pinched at the last time?
Yeah.
That's where the pinch is when the neck is painful.
That's where you're feeling it, right? Yeah, that's very typical. It refers down the trap muscle here into the shoulder blades, all the connective tissue in there. It's kind of gets jammed up. Basically sticks together. Now we're going to start to push on some of the areas that are just not moving properly or misaligned. Take a deep breath in and hold out. Let your shoulders drop. Let it go. Good. You feel that?
Mm-hmm.
Okay, not painful, right?
No.
Okay, just getting normal motion to those joints so they can work properly and those muscles aren't being snagged like that. We'll do the same thing a little bit lower here in thoracics, all the way out, let go. Relax. Good. Excellent. A little tighter in that area. Okay. Now what you do is flip over to your back, please. press right in here.
Yeah, it's
Tender,
really,
yeah. That's where that bone is out of alignment. You have a little bit of swelling or inflammation around the joint there, and that prevents it from moving properly, and that's what's causing you discomfort. So I'm just gonna bring it like this, relax, come over a little more, good, relax, let go. Good. You okay? It's still attached. It's still attached. Now, when I press in there, I'm sure you don't feel the same thing, right?
Yeah,
Yeah,
absolutely.
it's not swollen
It
in there.
already feels like release.
It's released, yeah, exactly. Now on this left side, you're also having a little bit down here, so we're gonna go a little lower. Same thing, relax. Good, excellent. Good, perfect. Just relax your head. You okay? Okay, we're basically just gonna traction your neck. We're just gonna lift some pressure, gently create some separation where those joints are, where the bone and discs are. Make sure those nerves are not being irritated and those muscles get stretched. We're gonna hold there for a few seconds. Good. And then we're gonna release, then we're gonna do it again. This time we're just gonna pull, release, and then just a little bit of snap, like that. Good. Good. Okay. Now, what I'd like for you to do is slide down a little bit on the table, right there, good. Bend your knees, put your feet flat on the table for me. Okay, and I want you to cross your arms like this and kind of give yourself a big hug, nice and tight. And we're gonna roll you over like this. Take a deep breath in for me, and breathe all the way out, let it go. All the way out. Good, excellent. That's the one I missed the other way, okay? Excellent. Okay, relax right there. Good. Come back around and back muscles. Okay, so do a little more muscle work in here to your shoulder. So I'm just gonna position your head, move those joints, get those muscles stretched as I apply a little bit of pressure onto them so we can get the normal range of motion and there's no restrictions. Good. You okay? Good. Excellent. Good. Okay, now let's sit up. So during your exam, and I notice sometimes you have a habit of just kind of slouching forward.
Yeah.
Okay, and it's because how tall you are. Your muscles need to support that frame. So I want you to sit nice and tall. Okay. What I'm going to have you do is kind of bring your shoulders together like this. Hold that tension there. And then we're just going to stimulate some of those little receptors in the joints. Kind of remember, you want your shoulders back. This sends a message up to the brain, back down to those muscles. And we want those posture to lie. And you're going to hold that tension, you're going to come back with your head like this. Okay, relax everything. Good. Relax everything. Good. Alright, now, what I'd like you to do is turn to the left. Good, that's normal, and then to the right. Very close to normal. That's great.
Yeah.
Now you also said when you tilt your head to the right, you have to stuff the right. Anything there?
No, it feels like better. Like feels like I'm oiled.
Good, you're oiled, yes. We oiled you up. So that's all we're going to do today. We're actually going to finish off with some ice and electric stimulation to help clear out any rest of that inflammation there. And then we're going to do a laser treatment, which is going to help to withdraw a lot of water, blood, and nutrient into the area to create more cellular healing. Both of those modalities are completely painless, not invasive, and feel pretty good. Okay. You want to just briefly describe your experience today so far?
It was really good. I feel like I'm already able to move more my neck.
Great.
So
Awesome.
definitely I recommend this place.
And painless, right?
Yeah, absolutely.
Good.
It's not painless. It just has like a scary sound.
Yeah, it's scary sound, yeah. But it feels better though.
Yeah,
Right,
absolutely.
that's the most important thing. All right, excellent. That's all we have for today. I encourage you, if you like the video, click like, share it to different platforms. We're on Instagram, we're on Facebook. You can also check out more information on our website at fanwoodbackrelief.com. If you have any questions, feel free to call the office. We're here to help. Thanks for listening. We'll see you next time.